Rehabilitation following your breast cancer surgery is essential to restore your shoulder mobility, prevent complications, and optimize your recovery. After your operation, these are some of the issues that you may need help with: pain, loss of range of motion, fascial tightness, scar adhesion, and axillary web syndrome, sometimes called cording. Axillary web syndrome is a common condition that affects 50 to 80% of patients that undergo axillary lymph node dissection, and it is often called cording due to the visible cord-like structures under the arm. During this video, we're going to show you some safe movement techniques, some scar care, breathing exercises, and also what to do if you have axillary web syndrome. Remember to get clearance from your oncology team or surgeon before starting any new exercises. This is a video for education and should not replace medical advice. During your recovery, you should always check for any signs of delayed healing, infection, or any signs of new swelling. If this happens, make sure you report this to your medical team straight away. One type of swelling which can occur in this area is a seroma. I'll put a picture of that on the screen here. Now, if you think you have this, once again, make sure you report this immediately. Let's start with the early rehabilitation exercises. You can usually start these straight away, and the aim is to move the shoulder without stressing the healing tissues, and also to support early lymphatic flow by doing simple arm exercises like this. Let me show you what you can do. Perform this exercise 10 times every waking hour. It will help with lymphatic flow, keep your grip strong, and your elbow mobile. The exercise is very simple. Start with your arm straight and your hand open, and then close and make a fist as you flex your elbow. When you make a fist, tense your fist and tense up as you flex your elbow. And then as you open up and straighten your arm again, you can open up your hand again. So it's working on grip strength, mobility through the hand and wrist, and also mobilizing the elbow joint. Generally, it moves the whole arm, which then helps with fluid flow, and that helps to prevent any lymphedema in the arm. This is the next exercise. Lift your arm up to shoulder height, not above shoulder height, just up to shoulder height, out to the front and out to the side. Repeating this routine for 1 minute, 3 times a day. When you're doing this, if you feel any pulling from the wound site, make sure you report this to your medical team to make sure you're doing the right exercise. Next, perform this mobility routine for 1 minute at the start and end of each day. So we have the rowing action, then we have the shrugs, all the way up, all the way down, and then the spinal rotation. So rotating your head and torso right round and the other way. So we'll go through that again quickly. We had the row, pull back, push forward. We had the shrug all the way up towards the ears and down. And then we had the rotation, twist around and the other way. Twist around. Run through that routine for 1 minute at the beginning and end of each day to keep your upper body and spine nice and mobile. During the first 2 weeks, it can also be a good idea to do some breathing exercises to fully ventilate your lungs. So as much as once an hour, take a long, slow, deep breath in, breathing in through your nose, hold for a second, and then take a long, slow breath out, ideally through pursed lips. Pursed lips will help to slow the flow of air, and that will help you to exhale for longer. So as I mentioned, you can do this as much as once an hour. Of course, you can overdo it. If you do too many deep breaths, you might go a bit lightheaded, so don't do that. But once every hour is plenty. During the first 2 weeks, you need to avoid lifting heavy bags and be careful opening and closing car doors. These movements and activities, which we often take for granted, can put undue stress on the fragile wound site, so make sure you're extra careful for those first couple of weeks. After 2 to 3 weeks, you should be ready to move on to the intermediate phase. Now, the first phase was 0 to 3 weeks, and this is 2 to 6 weeks, which does allow for some overlap between the two phases. So our aim now is to progress the motion towards a full shoulder movement. So it's okay now to start to lift your arm up above shoulder height. I'll also show you how to prevent tightening across the chest wall. And we'll also introduce some light functional exercise. So here's exercise number 1. Interlock your fingers and place your hands behind your neck. Then pull your elbows apart so that you get a stretch across your chest. Hold that stretch for a few seconds and then return back to the starting point. For the next exercise, lie on your side with a pillow for comfort. Have your knees bent up so that you're stable. Interlock your fingers and once again, place your hands behind your neck. Start with your elbows together and then lift the upper elbow back and also allow your spine to rotate, but do keep your knees together. This will stretch across your chest and also stretch through your spine. Hold the stretch for a few seconds, repeat 3 to 4 times, and repeat the exercise on both sides. Next, we're going to start some strengthening. So lean onto a stable surface, such as a worktop. Let your shoulder blades squeeze together so that your chest starts to drop through your arms. And then push away so that your shoulder blades splay apart and you push away from the surface. For the next exercise, from the neutral position, shift your weight from one side to the other so that you're taking more weight through your left arm and then more weight through your right arm. And finally, the third option you can try is a quarter press up. So just going a little way down and back up. If you feel strong enough and confident to do so, then you can progress a little bit further towards a half press up. And the final exercise routine can be some light resistance band work, working on lifting that arm up above shoulder height. Just using a light resistance band, you can find something like this easily online, or you could use a light weight such as a bag of sugar or something from the cupboard, for example. But the idea here is to start to get that shoulder up above shoulder height and also to introduce a little bit of resistance. All of these exercises can be performed daily, ideally twice a day, but do stop if you feel any pain and discomfort and make sure you report that back to your medical team. Scar massage over a healed scar is often recommended. You can start scar massage usually after 6 weeks and when the scar is fully healed and dry. When you begin scar massage, do a light massage for 60 seconds, 3 times per day. Use a scar cream or lotion that's prescribed from your pharmacist or from your doctor. Now, it's not advisable to do scar massage whilst undergoing radiotherapy because the skin can be more fragile and more sensitive. During the final stage of rehabilitation, if you find your shoulders are still a bit stiff, you may need to do some more vigorous stretching. So I'm going to show you a couple of techniques. Here's the first one. Take a bar or pole, a broom handle is ideal, and hold it with a nice wide grip. Keep your arms straight and raise it as high as you can above and even slightly behind your head. When you do this, you should feel a stretch through your chest. Remember to stop if you feel any pain, but if you feel a stretch, that means it's likely helping. When you feel the stretch, hold it for a few seconds and then come out of the stretch and then go back into the stretch again and repeat that 3 to 4 times. This is a good stretch that you can do on a daily basis. Let me show you another one. So this exercise is called the snow angel. You're supposed to lie on the ground and do it in the snow, but it's more practical to do it up against a flat wall. Just remember to take your watch off or any jewelry before you do it so that it doesn't scratch along the wall. You start with your arms down by your side and arms out flat against the wall, and then progress up as far as you can, keeping your arms against the wall, going all the way up if you can. If you find it a little bit difficult, that's okay. Hold that position, feel a stretch for a few seconds, and then come back down again. So that's the snow angels. You can repeat that a few times. Once again, a great daily exercise. In this next section, I'm going to show you a technique that can help if you have axillary web syndrome, what we call cording. Now, cording presents as tight bands on the inner arm running down into the axilla, that's the armpit. And it can limit the ability to lift the arm out to the side and in front. So when you're trying to elevate your arm and reach up, the cording can cause discomfort and a limited range of motion. So I'm going to show you a technique now that can help to manage that and also to increase your range of motion. Now, before I show you the exercise, the cause of cording is not known, but it's thought to be from clotted or fibrosed lymphatic vessels in the arm, which causes that cord-like appearance. Now, the good news is there's no link between cording and lymphedema, and there's also no link between cording and cancer reoccurrence. So this is the technique to improve your shoulder mobility if you have cording. Stand flat against the wall so that you don't arch your back during the technique. Lift your arm and then take the opposite hand and place it above the scar area. Press in and down to lock the scar and soft tissue in place. And then begin to lift your arm up into the resistance whilst you're locking down the soft tissue with that opposite hand. Push into the resistance gradually, and it helps if you take a long, slow breath in, followed by a slow breath out as you move up into the resistance. So this is a great technique that you can do a couple of times a day, locking the soft tissue in place to protect the scar area, nudging into the resistance and using your breathing alongside the stretching as well. Before you go, a few important safety considerations. Always liaise with your oncology team or surgeon before starting any new exercises. Monitor and immediately report any signs of infection, delayed healing, or new swelling. So remember, early mobility of your shoulder can help to prevent stiffness and help with your healing. Axillary Web syndrome is common if you've had a lymph node dissection, but we went through an exercise strategy that you can use if you're suffering from cording. With everything that we've gone through in this video, consistency is key, and most patients see great results after 3 to 6 months. If you're also suffering from fatigue following your treatment, then you may find my fatigue management video helpful. I hope you found this video helpful. Please share it with anybody else you know who may find it useful. You've been watching the Physio channel. My name's Daniel Lawrence. Thanks for watching.